All right, I have 10 o'clock, so we'll go ahead and get started. Let me go ahead and begin by saying if you have a cell phone, please turn your cell phones off to the vibrate or silence position. The Opioid Abatement Funding Advisory Board allows any person to speak regarding an item on the agenda. The speaker is limited to 2 minutes unless otherwise determined by the chairperson to allow sufficient time for all speakers. Speakers shall refrain from abusive, profane remarks, disruptive, outward protest, or other conduct which interferes with the orderly conduct of the meeting. Upon completion of the public comment period, discussion is limited to the board members and questions raised by the board. So I'll call this meeting to order, and we'll begin with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Has everyone had a chance to review the minutes from the previous meeting?
Yes, ma'am.
Okay, do I have a motion to accept?
Motion to accept the minutes as printed.
Second.
All in favor?
Aye.
All right, we'll go ahead and start with our public speakers. The first speaker that I have is Walter Arrington.
Good morning, board members. I'm Walter Arrington with Community Health Northwest Florida, 2315 West Jackson Street. If I may approach, I've got some material that I'd like to. So what I'm passing up is just the grab flyers for the core program that's currently in operation in Escambia County in partnership with Escambia EMS, Community Health Northwest Florida, that's been in operation for 3 years now. I'm here today in support of our grant application, of course. Open to any questions that you may have when the time comes. I will say that I'm grateful that this board has taken the time and energy to read over these grants and trying to address the great need that we have in our community. Thank you.
Thank you. Drayton Smith.
We have material as well. Thank you. Thank you, Drayton Smith and Nicole DeBono from Ministry Village. We have a women's addiction recovery program, and that program is up to a 2-year program, the only like it in the area. Right now, we can house about 20 ladies, and we are pretty much at capacity. We're doing that through old buildings, 3 different buildings that are very costly to keep up and very hard to insure because of the new insurance policies and things like that. So all 3 of those houses, we cannot get wind coverage on there. So if we were to have damage from that, it would be a burden for us to do that. So right now, we can hold up to 20. We're looking to build a new building that'll be a single unit, almost like you would think of like a nursing home type facility, but still a home. And then we'll have 30 ladies that can stay in that, and then we would use 2 of the other buildings, 2 of the 3 other buildings for for a transitional housing after the ladies graduate the program until they're ready to go back into society. So that is our ask today. Nicole has some stats on that as well.
Hi, the Caris House is a 12-month recovery program, and just looking back in past years, I would say that we had only about 50 applicants in the past 5 years. Because of the crisis, we've had 300 applicants this year, and we just don't even have enough room for the ladies. So it is imperative that we get the room to house all these ladies. We have waiting lists. We have a 86% success rate of women that complete our program and stay sober and live out their recovery. We have a 100% success rate of ladies that are reunified with their families and children. Yeah, we are in great need of a new building, just so we can give these ladies a chance. We opened up a new jail ministry, so a lot of the women, we're approaching them while they're still in jail and while they have a clear head, and we're getting them signed up for the program, which we go pick them up directly from jail. Most of them get an alternative sentence instead of prison to better their lives. We take them back and forth to probations and do all the legal stuff, but it's really boosted our numbers up and given them a second chance at life.
Thank you. The next speaker that I have is Vinnie Webbs.
Good morning, Vinnie Webbs, Executive Director of Reentry Alliance Pensacola. Just briefly, Reentry Alliance has been working with returning ex-offenders, men and women, for the last 12 years. About 2.5 years ago, we became increasingly involved working with homeless individuals. Needless to say, about 60% of the individuals that come through our program have some type of an addiction situation, dealing with either drugs or alcohol. We believe that we've had a considerable amount of experience over the last number of years, having worked with more than 2,500 people in this thing. And currently we operate 22 houses, but our plan is to house the individuals that are going through this situation and to provide them with the structure, the counseling, and the services needed so that they can terminate. Okay? Will that answer any questions that you have?
Thank you. Okay, that's the last of the speakers. So we're open to discussion for the opioid funding. Is there someone else need? Okay. Do you have the budget reviews or something specific for
I do.
that?
So
Okay.
what we have left for the
Okay.
amount of money that we can currently obligate or move forward is $2,518,078.86. Just a reminder that we should be getting some additional funding in 2025 and for the next 16 to 18 years going forward. So the idea would be put this notice of funding availability out again in 2025 in the June, July time period, and to continue to do so every year after that. So if you don't award somebody this time around, they certainly are more than welcome to apply again for the next coming season.
Thank you. Does anyone have any questions?
Yeah, do we know how much we might get in 2025 yet, or no clue?
We have no idea. In 2023, just to give you an idea, the very first year, we got just under 2.5 million, and then in 2024, we got 1.5 million. So that's $1 million difference, so I'm not really sure.
Any other questions? All right, we're open for discussion on the funding allocation for those that have submitted applications.
Okay. First of all, I'd like to, if we can, call the speaker for Community of Northwest Florida back up, please.
Good morning, board members. Walter Arrington, Community Health.
Hey, how are you?
Good.
Okay. Kind of first time kind of getting familiar with you. We've had the core program representative here since we've actually started this board, and greatly appreciative of them being a part of this process almost for 2 years now. Matter of fact, I think they was. So Community Northwest Florida, you all are the facilitators of the core, and it's just, well, the EMS are the facilitators, and so I take it came down through the state, through you all, and you guys kind of oversee that, correct?
Correct. The intent of the core program was to expand medication-assisted opiate use disorder and substance use care within the federally qualified healthcare center network in the state of Florida. Traditionally, that had been housed and supported through the community behavioral health centers in our community. That would be Life View Group. And so the way that the program is structured, patients overdose, they're flagged by EMS. EMS either inducts in the hospitals or they induct in the field, and then after 7 to 10 days, they transfer to our care.
Yes, they do a great job at that. I've actually visited the center and actually walked through with the chief and the assistant. They do a great job. They're actually hands-on, real-time action, and I appreciate that. The question that came up in the last meeting about the funding, because we voted to give funding to the Corps already. My question is, and this is what I had Ms. Christie there, something about the state dissolving its support, and it's looking for this board to kind of kick in that to subsidize that. So and the reason I have a challenge with that, because on the onset, it was clarified to us very strongly by Ms. Christie, and these things change, I understand. This is not supposed to be a subsidized, long-term subsidized type situation for any organization. So my question is, after this funding here moving forward, how are you all looking to take care of their operational costs?
Yes, sir. So what we're actually asking for is an expansion. So our current capacity within the core program, we're not asking you to subsidize that. We manage that through payer mix with leveraged and matched funding. If you'll reference the West Florida AHEC Federal Assister Program, having those assisters that are able to assist individuals that are pathwayed into the core program and obtaining insurance that best meets their needs. And then ultimately, at the end of the day, as a federally qualified healthcare center, we're mandated by the federal government to provide care regardless of ability to pay or insurance status. And so this is a one-time expansion measure. Any future asks that would come to this board would be for, again, to fund the initial expansion to provide additional and more services. So this ask is not to maintain the current services that are in place, but rather to expand and be able to provide a broader scope of services to the community to help meet the need.
And last question, that I have some. How are you going to use this fund to expand? Like, what is that expansion? I see your report here, but I'm saying, like, how are you going to be able to really do that?
So currently within our core program, we have 2 mid-level providers. We have a PA that's got special licensure to provide MAT services as well as psychiatric care. And we have a nurse practitioner that should be licensed here pretty soon to provide that care. What we're proposed to use this funding for is to hire on an MD to supervise. So essentially, that MD would supervise to establish essentially a standalone practice and service line. Additionally, we're looking towards expanding training to other providers within our network that are already established with us, and then looking at providing a more robust mobile unit service. Community Health operates 3 mobile medical units, 2 dental, 1 medical. We currently deploy to some of the hot spots in the community. And being able to offer those MAT services and follow-up appointments on that mobile medical unit. Additionally, one of the kind of built-in cost to our patient empanelment is that the first 90 days, we cover the cost of medications for the patient if they're unable to pay. We also provide transportation services. So, it's $80 to get a Z-Trip from a patient from Century to an appointment, and in the first 2 months, we're meeting with them 8 separate appointments minimum. And so there's some funding, again, when you start expanding an empanelment, needing to have that initial funding in place while we work through developing that payer mix for long-term sustainment.
Well, I appreciate you being here. I mean, I'm a fan of your program. I just kind of got to drill down a little bit in the spirit of what we was tasked with and the survey coming back and what the kind of the things that our priorities were. And you guys hit the nail on the head long before we've actually got to this point, and I appreciate everything that the core program do. Thank you.
Thank you, Vice Chair.
Just to clarify, the money that we had to kick in for the core program went to the EMS side of this, correct? Not community
That is
health?
correct, yes.
Okay, I just want to clear that up because I thought that's what it was.
Yeah.
Yes.
See, that's where it gets kind of confusing. So the first monies went to the EMS side? Okay.
Yeah, it all
But they
went to
work
that.
hand in hand, yeah.
Yes, yes.
So-
Oh, of course.
So
No,
you've got to
that-
Yeah,
have,
but-
you have the front end of it, and then you have the treatment and carrying on with the,
Yeah.
But the state took the money, and that money was going to the core program, the EMS side of it, not the community health side of it. So what we did last time just went to help fund the EMS side of it.
Yes. Yeah.
So hopefully that clears that up.
thank you.
Thank you.
Does anyone else have any questions or discussion about the applications?
So do we need, are we gonna, so, okay, so this to ask right now, we have to, I think we have to take one of these one at a time, kind of like for as approval wise, because you can't really approve all of these because there's not even enough funding to do that. So, Ms. Chairman, so would you like to take these one at a time as far as voting on funding requests and discussion?
Do you have, go ahead.
I was going to say, I think we need to nail down how many we want to fund, if we want to do the top 3 or top 4. Figure that out, and then you could divvy out the money.
Yeah.
I think we need to figure out how many we're going to fund, and then once we figure out how many we're going to fund, decide how much money we're going to give each one of them. I think that'd be the best way to do it.
Okay.
I'd like to hear from some of them, because some of them we've never heard from them. We don't even, I mean, some has been here since for like the inception, but there's a few on here that have no idea who they are, or what they actually do.
Well, you heard from the top one, and
You've
Is
heard
there
from
the
Reed also.
second place one
Yeah.
also.
Is the lead here? Yes, could you come up, please?
May I bring each of you one of these?
Yes. Yes, when they came up, I didn't know we were actually gonna need to be in discussion with them about that. I thought they were just kind of like introducing themselves.
My name is Lisa Roderick, by the way. It's nice to be here.
I'm sorry, what was your name?
Lisa Roderick.
Okay.
So LEAD is been around about 15 years now, almost 15 next month. And they took actual evidence-based curriculum through the Mendez brothers, and they use the Too Good for Drugs and Too Good for Violence. They partner with law enforcement and the local schools to bring that in. And they also started partnering, because Florida has a guardian program, with any of your guardians at the schools. They bring the program in its grades K through 12. It's aligned to CPALMS. It's aligned to national standards across the board. And they then have aligned to each state. So it covers behavioral standards. It covers educational standards as well.
So, I'm sorry, go ahead.
How are y'all implementing that in our school district here?
So
I know you
Escambia would-
said the Guardian program and all that, but how is that actually being implemented?
So what we do is we come in and we have regional directors, because we're in all 50 states. So your regional director, I left her card in your folder in case there's questions I might not be able to answer. She unfortunately had a work meeting in New Jersey and couldn't be here. But her contact information is there. And what we do is normally, because the challenge is getting your officers and your guardians trained, because when school's in, they're there. So we try to work it around, whether it's spring break, fall break, Christmas break, summer break, at some point to give all of those who haven't had any experience in the classroom with doing anything with education with kids, it's a 5-day program. In those 5 days, they get their curriculum, they get this kit, and it has all the grades in there for them. And within those 5 days, they learn how to deliver it. And when I say how, they get a true hands-on. By the end of the week, they're delivering part of that curriculum to the rest of the class, so they're hands-on understanding. The curriculum itself, there's some examples in here. On the right side of your folder, at the very end, I gave you an example of a lesson because this is what your instructor gets, your SRO.
There's
Yours is
nothing
empty.
in the folder.
Yeah, there
I'm
We have
so
a couple that are
sorry.
empty.
Thank you. I apologize for that. I do.
Roger that.
the business card was in there, but that was it.
I brought 10 of those. You need some? Okay.
They were all empty, I think.
So in the lesson, it gives the instructors what the rationale is for the lesson itself. And then as you look through it, everything that is bold is what it tells them to say. Because obviously, the majority of our SROs and a lot of our guardians don't necessarily have classroom experience. And managing behaviors and running through lessons and creating lesson plans is not their forte. So this spells it all out for them and kind of walks them through. They can make their own notes. They would have an actual book, and they can make their own notes of things they might want to highlight or look for and things like that.
I have a question.
Sure.
One simple question. This is the opioid abatement board, correct?
Correct.
You understand what we do here?
Yes, sir.
What we've been tasked with. My question to you, how does this help us accomplish the mission of opioid abatement?
So what this does is, in the opioid abatements, you have to have prevention programs. This is a prevention program that goes right into your schools. So you're reaching
But
all your
how-
students.
But my question is, what is your opioid education in that? Like, what is your, like, I hear your behavior things, right? But where do you get to the core of addressing opioid information, education, and awareness?
So what this will do is it'll work with students on your resiliency. How do you say no to that peer pressure? How do you know what to look for when you think there could be something wrong? These are the things they give them. And they give them a pre-test and a post-test. So in the pre-test, they look to see, what do these students already know about these things? What do they not know? So then they can pinpoint what to work with these children on. So then you're getting to them at a younger age. A lot of districts choose 5th grade because they're getting ready to go to middle school, which is where it seems like they start to pick up and sometimes do some of the things we wish they wouldn't. And so this teaches them and gives them that confidence that, no, I'm not going to do that. And if you can stop them from starting at a younger age, you're going to be able to overcome that.
Are you already approved to go to the schools to do this type thing?
Yes, ma'am.
Okay, so this has been approved with the Escambia County School Board to be able to bring this to
I think we've been
them?
in some of the private schools here.
Okay, private schools. Also, law enforcement. Are you already partnered with law enforcement, or is this something that you're in the process?
No, Beth has already reached out. She's your regional director, and she herself is a retired captain from down in Naples, Florida. And she's already reached out and has already spoke to them and partnered with them.
So, okay, law enforcement is because she's a part of law, used to be a part of law enforcement.
Yes,
That's how
sir.
the name come about. Not the fact that you're a part of law enforcement. It's just the fact that you
partner with them.
She just kind of used that name because she's former law enforcement.
Yes, she's former, all of our regional directors are former law enforcement, so that way they kind of know what they're facing. A lot of them did something like a DARE program, or they did LEAD prior to leaving the force and working in the private nonprofit sector.
Okay. And how is this funding going to be used? Like,
So this
your
funding-
package is pretty thick, and I kind of was reading through it, but I'm still trying to figure out, it says a lot about your history and things of that nature and how it's come about. So, I'm a simple kind of person.
Okay, so it's real easy. This funding would go to train all your officers and your guardians. It would cover all the kits that the school needs, all the workbooks, any of the extra materials that the schools might ask for. It would just cover all of that to get it in and implemented in the school.
So it hasn't actually been implemented in school. So now your officers and your guardians, aren't they already trained through law enforcement? Being that they are in law enforcement?
But that's not what they're not trained to take a lesson into the classrooms and deliver the lessons.
Okay, so are you just starting this as of right now, or you're kind of like in the private schools?
So
but-
we're across the state of Florida, and in Escambia County, we have a couple private schools. We would like to get in with your public schools to help broaden that reach and reach more children.
Have you been approved for that?
We have not went to the school board, no. We've went and we're partnering with law enforcement right now.
Okay.
Is there a memorandum of agreement with the law enforcement agencies, Escambia County and Pensacola Police Department and any
I
others?
believe so, yes. But I will double check.
'Cause I've actually, I'm retired law enforcement myself and been retired 14 years now. You said this is 15 years old?
Yes, sir.
Okay, so I'd never heard of it prior to this coming here, so, okay, thank you.
All right. Any other questions? Thank you.
Thank you.
Okay. We're going to try to make this rather quick. The representative from Lakeview, are they there? Are they here? Yes. Can we hear from you, please? Because I see you have two on the docket, two programs on the docket. Okay. Which one are you with?
We applied for 3 additional personnel for the CAT team, Community Action Team, to specialize in substance abuse.
Okay, and so those personnel, they go out into the community, and how does that actually work?
Yes, sir. It's based on the CAT model. They go to folks' home and schools. We don't do office work so much as we work in the home with parents and their children. It'll have an RN/case manager, a behavior tech/peer specialist, and a therapist on that particular team. Our CAT team is a little bit bigger than that, but the program is 6 to 9 months in total. We had a TRACE team, which was a substance abuse team based on the CAT model, and it did not get refunded this year.
And how do you get your referrals? How do people end up getting into your program?
We get referrals from the school system. We get FFN, DCF referrals.
And these are people that are known, like kids that's known to be using, like they know for a fact they're using this. It's just not like behavior therapists. I mean, it's a mixture of all of that, but they have actually a substance issue.
Yes, sir.
Okay. And this is ages 5 to 18.
Yes, sir.
It's so funny about that because on the onset of this, we talked about a program, and you all used to have a program called DART.
Yes.
And it was a facility, intake facility, and one lady here, Miss Stephanie, and there's been a few stories that come about children under the age of 18, and they're not having to get facility. There's not a facility here to actually service them in-house. And to me, that was a real issue because one of the ladies had to take their kids all the way to like Tennessee or
Yes,
Nashville,
sir.
and her son ended up dying before she could actually he could actually get help at the age of 18. And then we had another young lady, that son ended up dying also. thank you for what you do. And, you know, I know it's a pretty heavy lift. So 5 to 18, how long have you been in existence? And how many people do you have right now staff to do this?
Well, I manage the Department for Community-Based Services, and in our department, there's about 100 people, 100 team members, all the way from clinical supervisors down to behavior techs and peer specialists. So we have 4 CAT teams and a FIT team, as well as children's case management.
And how many people on the CAT team, are on a CAT team?
Altogether, we've just combined them
Right.
instead of being separate. So altogether, there's probably 28 people on the CAT teams.
Okay, and those are ones that go out into the community and are hands-on?
Yes, sir.
Okay, and
Yes,
this ask today is going to be to expand those CAT teams or
Just
shore it up?
Yeah. Expand it to specialize in substance abuse. Mainly what we have now are like behavior problems in the schools, delinquency,
Okay.
but they don't specialize in substance abuse, so it'd be some specialized training. Again, we used to have a team that focused simply on substance abuse, and on that team, we helped a lot of people who were impacted by human trafficking as well. So there are a lot of trauma-based
Okay.
issues.
So, so this money is going to go to create that specialized team that the trace went away, they were doing that, and so now you want to put another team in place in order to go out there and be hands-on to do that.
Yes, sir. And like you were talking about, there's very little access to any substance abuse counseling services in this area. I know CDAC goes into the schools and does it, but we go into the homes as well and
Okay.
work with parents around keeping their kids substance-free.
I'm sorry, will you go ahead and state your name? This is a little bit backwards, but go ahead and state your
Sure.
name.
Patty Hyde.
Patty Hyde. Thank you.
What are the age ranges of the people y'all are helping with this program?
I'm sorry, say that?
The age range of your patients?
5 to 18.
How many are in your program now?
We don't have a program now for
Oh,
substance
okay.
abuse.
Okay.
This is an initial program that they're wanting to start, is my understanding,
Yes,
for
ma'am.
5 to 18. So it'll be a CAT team designated specifically to that age group.
That's correct.
They're trying to replace kind of like what that trace was doing, that went away, so they're trying to bring it up under, I guess, in your house.
Trace had 7 team members on their, in their team, and so would like to put 3 out there
Okay,
in lieu of those 7.
thank you.
Thank you.
You're welcome.
Any speaker for the Lakeview Optives? Nope. Okay, let's move forward. The Ministry Village at Olive, could you please come back up real quick, please?
Yes, sir.
How are you?
I'm doing great, thank you.
Good. Okay, so the Ministry Village at Olive, so you deal with ladies that's kind of like in transition, I take it from law enforcement, from the jail?
Not necessarily, no, sir. So a little clarification on that. Our ladies can, if you have a daughter or your wife, you can go through the procedures and she comes into our program, or Nikki works directly with jail, judges, DA, lawyers, public defenders, all of those, and ladies that are incarcerated to be able to get them to come into the program. Not all of our ladies come from jail, no, sir.
Okay, so real quick, I know we're running down the line. Your program, so a lady comes in, like exactly what do you provide?
We provide mental health counseling on a bi-weekly basis to start, or excuse me, twice a week, and then that goes, as they progress through the program, that goes to weekly. We provide job readiness skills, we provide transportation, we provide them with all of their needs that they may have as far as medical, getting them to the facilities they need. We work very close with Community Health as well as Health and Hope Clinic and some of the other partners. We work very close with Lakeview as well in making sure all of that's taken care of. We offer GED programs for those that need it, and we also do college education for those that do have high school diploma or GED. We offer continuing education as well.
Okay, so no treatment as far as like medical treatment or anything of that
Not
nature?
in-house. We use our community partners for that. Yes,
Like,
sir. We work very
Lake-
close with those.
Lakeview in Northwest Florida.
Lake Baptist Hospital, Lakeview, Community Health, and Health and Hope Clinic. Yes, sir.
Okay. All right. So ladies come in, and so like what type of issues do you like? What is it like? What do you like? They come in and say, I have an issue. Like, how do you determine them? Like, what is your screening process? Like, what do they have to have going on before they are inducted?
Absolutely. So any type of addiction, drug or alcohol, Nikki does our intake coordination. She's our intake coordinator and our case manager, so I'm going to let her address that.
Yes. Well, there's a screening process. So if they're suffering from substance abuse, if they've been, we'll ask them the questions, what kind of drugs were you using? How long were you using them? You know, what has using these drugs done to your life? You know, what effects have you noticed? If a lady is in active addiction, we'll partner with the community like Lakeview to get them through the detox procedure part, usually 5 to 10 days, and then we'll take them directly from there. And we're training them and giving them the tools that they'll need to have a successful recovery. So while they're with us, they're learning a curriculum, 12-step curriculum, Genesis Life Recovery Program, group meetings, one-on-one counseling, like he said. Our counselors are trauma-informed, so that's really helpful as well. When the ladies come to the house, they have nothing to worry about except for healing from the inside out. We don't allow cell phones. We don't even allow them to have a job. We take care of the food. We take care of the clothing and the hygiene as well.
So, okay, just real quick. So a lady comes with a problem. So actively an active user, or like, hey, I have mental health. So what if they're not an active user? So what happens then?
I will refer them to a place that we can help them with the needs that they have. We're just for drug recovery.
Okay, so you actually for people that's currently like actually have like I have a problem and I want to get help. So you would be
Yes, sir.
considered a nice wraparound service facility.
Yes, sir.
Okay, is that
What do you mean by wraparound?
well,
Define
kind of
what
like
you mean
where
wraparound.
people, you know, you're not doing the treatment, but you're kind of like that facility that kind of help facilitate the other things like the mental health counseling, like you say, the transportation, kind of helping them get their life together.
I would say that once you get clean, that's not enough. Just removing the drugs is not enough. So we're here to help them build that tools and fill up their
Okay.
toolbox, how to remain sober and clean.
And how long is your program? How long are they in there?
The first portion of it is a year. They can stay longer than that as they need. If there's a specific need, for instance, we have a lady now that's in the program who has absolutely no family, came here because of a boyfriend that was basically an exploitation type thing. She has nowhere to go, so she's now working on her GED. She is working towards a lot of other personal goals, and so she'll be able to stay a little bit longer than that, up to 2 years, and then there's an evaluation time through that.
Okay, and how many can you facilitate at a time?
We can hold 20 right now.
Okay, so it takes 20 every 2 years, is that correct?
No, sir. Most of them graduate at the year and go back to either their own resources or to family or friends or to a safe place.
Okay, and this expansion, how many
So,
can
so
you?
the program is actually a year-long program with a possibility to stay longer as needed, case-by-case management.
And this money is what, how many can you help additionally?
The
If you-
facility that we're looking at building would hold 30 on its own, and then we would retain 2 of the 3 facilities that we have now for transition. So that would be, you'd be able to have those 30 in-house, and then those transitional houses would be the ones that could stay if they needed to stay longer. They would have an opportunity to stay in those safe houses.
So with that being said, when you combine those two, how many could you facilitate at one time?
40.
40?
Yes, sir.
40, so basically 40, going through 40 a year,
That's right. Yes, sir.
roughly? Okay, thank you. Sorry about that, I just.
No,
kinda-
that's fine.
you- Some of this is here because it's our first time kind of like
Absolutely,
introducing. Where you guys been for the last 2 years?
We've been here since 2008.
No, I'm talking about here, like.
Oh, in front of you?
Yeah. So,
Well, I'll tell you just a short story about that. So we have we have made a lot of transitions, and now we are working more with the community. We're working a lot with like-minded organizations, where at one time we were just kind of in a shell in a different world and in our own little place. And what we found out is the need was so great, we were the best kept secret in the Pensacola area, so that's why we're moving forward with it.
Well,
And so that was my question for wraparound. I will make sure that we are basically your one-stop facility, and we're going to get you all the resources you need as you go through that program. We do not have a detox program. We allow that to professionals just because of the risk and the things like that. So Baptist Hospital, Lakeview, the Pavilion, those type of places they go to for detox, and then after that they come to us.
and after that, you pick up the ball and you run with it and you take it to the you score, huh?
Thank you.
Roger that.
Quick question for you.
Yes.
What is your primary source of funding now, currently?
We have individual donors, grants, churches, industries. We just received the Impact 100 grant for the first time this year, and we were told we would never get it, and so we did. So again, Mr. White, we're moving forward with what our vision and mission is, only to expand further. So we get them a lot like the other organizations do. We have a feeding program as well, so we have donations for food. So like-minded organizations, industries, individuals, churches, International Paper has donated to us, Baptist Hospital. We also do a fundraiser once a year. The only fundraiser we do is a clay shoot, and we received over $120,000 for that this year gross.
Okay, thank you.
Yes,
And one more question. So basically, you're one of, there are not
One?
many.
One of one?
One of one that offers these type services for women in the area. know
I do
there's
not know of
a
any
lot.
that offer the same type that we do for the longevity, and it's free of charge. Yeah,
Exactly.
I don't know
Okay.
of any.
I just wanted to
Yeah.
let the board know that. That's great. Thank you.
Okay. Well, I look forward to visiting your facility. And,
Please do.
and,
Absolutely.
Coming out and checking it out. Thank
Thank
you.
you.
Thank you for being here.
Thank you.
Mr. E, you have some. So Lakeview Optum's not here. West Minery Waterfront Mission. Is there someone to speak from Waterfront?
If you'll go ahead and fill out a form and state your name to begin with. I'm catching it early this time.
I'll go ahead. I'm Mark Isbell with Waterfront Mission. This is Jason Grizzard. So thank y'all for the process. So Waterfront Mission, we are applying for the back end of our recovery program for men. So our recovery program is 9 months long. The final 3 months of that program is actually inside of transitional houses that we have here in the Pensacola area. Back 2 years ago, we had 2 houses. And then we saw the increase in need, the increase in just people coming into our program. So earlier this year, we actually rented another house to expand that program. We're actually in the process of renovating a very small house that we've owned, but it was not in use. And so that house is about to be open. But even with those 2 additions, there's still a need. And so what we're looking to do is actually on the same property that 2 of our houses are on, we're looking at building a 3rd house on that property.
Okay, and so your access, so that 3rd house, how many will be able to be housed?
So it'd be a 4-bedroom house, and it'd be double occupancy in each room. So it'd be 8 men at a time in that. And ideally, they rotate out on a quarterly basis. And so it'd be up to 32 men a year would be in that house.
30, and that's transitional.
Correct.
Okay.
And so we actually also, it is transitional housing from the standpoint of we also have a RA that's actually part of our staff that would be living in that facility with them, just making sure that the guys are continuing on in their sobriety because they are still actively part of the recovery program at that point.
Okay, so I know Waterfront kind of does a few different things from the thrift store to the shelter, and I take this branch here is the
This is actually for our addiction recovery program.
addiction recovery program.
Yes, sir.
In that addiction program, what percentage would you say that program people come in as far as on the opioid side?
Jason?
I don't actually have the number for that, but we see quite a few that come in that are opiate users.
Okay.
So I don't have a percentage on that as of today.
And how do you get how do you get them in? Like, I mean, do they like self-volunteer come in, or they from law enforcement? Like, how does that work? They just come in on the
We've
street?
been around for 75 years, as you guys know, so we are well known in the community, and so we get people that come to us from, jails, from most of the people that we get. I think when I first started about 17 years ago, we did get a lot more from the correctional facilities. I think most of the people who come to us are, self-voluntary, and then we get a lot of family referrals. And so, but yeah, most of them are not from the Correctional Institute.
Okay, so I'm addicted. I come to you. Run me through your program real quick.
Okay. I'm Jason Grizzard, by the way. I'm
Nice to
the
meet you, sir.
VP of Ministry Services. As Mark said, we have a 9-month recovery program. It has 3 phases. And so the first phase is called Recovery Readiness, which is basically 2 to 3 months. And the goal there is to get you to a place of stabilization where we can go a little bit deeper into the life-dominating issues that brought you to that place in the second phase. The second phase is more intensive counseling. We use a curriculum called Genesis Process that is integrationist-based, so it's faith-based, but it also builds on what the industry knows of how addiction affects the brain, how addiction affects a lot of things biochemically. We go into that to kind of educate people on those effects, and we also we do a lot of assessments going into their past with their family, of any trauma. We have trauma-informed care of counselors that are there. And so that's a very intensive 13-week process, the second phase. And then of all of that, as they wrap up the second phase, we will start to do some preparatory steps towards the final phase, which is the transitional houses that Mark mentioned. And so that's where we try to get them ready to re-enter workforce, to get a job, to connect with a mentor, to build their savings up. Many of the guys that come to us, they have thousands of dollars in legal fines, and they have a lot of obstacles. And so we try to remove those obstacles, help them set up a bank account, reestablish credit, and then be accountable. Each person who is in the transitional phase actually has to create a relapse prevention plan as they go into the final phase, and we keep them accountable for that each step of the way. And so we've learned through the years I know that our stories are pretty well known in the community, but from business owners to CFOs to restaurateurs, we've had a lot of success stories in the community. And what we have learned is that the longer that people can stay in recovery, the better the chance they have of being successful, which is why this house is such a integral part of our wanting to lead to that long-term success.
Now, he said your program is 9 months, and they rotate out every quarter. So how does that rotate out of what?
So, so typically we have guys as they get into that final phase, and so we do the 9 months, and as Mark said, the first 3 months is in the transitional house. They graduate, we celebrate that, but then as those guys, start to save money, then they'll rotate out and they'll move to permanent housing. They'll move into a safe situation, and so that's our goal. But having the capacity of expanded, that will give us the opportunity to keep guys longer. When you have limited space, you have to kind of move them forward a little bit quicker than we would want to.
Okay, and my last question, in that first phase, how do you who does the treatment? How do you do that? Do you do in-house treatment, or you partner with Lakeview and the other community partners or whatnot? How does that first step, I come to you, how do I start to get that resolved?
Yeah, absolutely. So first of all, when you contact us, when you talk with us, we do work with a number of community partners in here. Lakeview is one of them. Of course, Caris House, you just heard from them. Community Health is on our campus in Pensacola. And we actually, at our entry phase, real quick, we have an entry phase at our Mobile Mission campus and an entry phase here in Pensacola. So we have guys coming to us from 2 different sites. But here in Pensacola, when you come to us, we're going to make sure that you don't need detox, that you don't need treatment, and if you do, we're going to outsource that. We're not going to do that ourselves. But once that step has been done, then you come to us, and then we will get more in depth into our intake process and then start the ball rolling.
And they stay with you the whole time?
That's
through the phase?
correct.
You're in-house, okay.
That is
In-house
correct, and we
facility.
drug test them. We also work with other community partners like AHEC of West Florida, who provides nicotine replacement therapy because we try to get them tobacco-free as well. And so we also work with Georgetown Technical College to get them their GED and a number of other resources.
Okay, that's it for me. It's great. We got a ladies' side and we got a men's side.
That's
so
right. Yep.
Any other questions? Thank you.
Okay. Thank you.
Last one, REAP. Anyone here from REAP? You shall reap what you sow.
Good morning. Vinnie Webbs, Executive Director of Reentry Alliance Pensacola, REAP.
Yes, sir. Quick question, down to the wire on this right here. Exactly how is this funding going to be used to help us accomplish our mission?
Probably the easiest way to respond to that is that we will utilize this funding to really improve, substantially change the program that we've been going.
Yeah, I was
been
kind of
in
reading
session
over
for a
your
great time.
paperwork, and it was just,
We have
I was
a,
just kind of confused about exactly how does that mesh
How
with
does
our
it me-
mission?
What do we have with the existing programs? Right now, we have a reentry program and a homeless program. And between the two, at any given time, we have about 200 individuals that are spending the nights in our facilities, okay? At the Maxwell Center, the homeless individuals are provided food as well as case management. In the reentry side, we have case managers. But what we're really finding is there's an increasing number of individuals that have this addictive personality. And you need to have more specialists that work in that field, a more intensive case management. And so our program is designed to start out with a certified addiction specialist and then additional case workers. Our plan is to increase this number of houses that we have. Right now, we have 22 houses, and then we have 2 larger facilities to house the roughly 180 people that we have each night. We would have some additional houses that are really dedicated to the opioid program.
So exactly what do you want to use the funding for? Are you trying to hire staffing, or are you trying to
It's a
get more
combination of both,
housing?
but the largest percentage of it would be to be hired the certified addiction specialist and the 2 case managers. The housing portion, what we have developed over the years is that we have funding that comes from the Florida Department of Corrections and from individuals themselves. We expect that, they should be working, they should be able to pay something for the housing. And so we can cover the cost of that. But what we really need is the specialists that can help them make that transition to a life that is not tied so directly to addiction.
Okay, so my next question, and kind of like along the line with Chief Mathis, how are you normally funded, and say you get help with obtaining these specialists for now? This only going to cover them for what, a year? This ask is going to cover for like a year. So now, how are you going to sustain their salaries thereafter?
Okay. To address first the question, how are we currently funded? Our budget right now runs approximately $1,500,000 a year. Out of that amount, $650,000 is funded from the Florida Department of Corrections, and that is $500,000 for Escambia County and $150,000 for Santa Rosa County. We have funding each year that has been coming in through the HUD program, through Opening Doors, which varies between, but it's approximately $200,000 a year. And then, as I mentioned earlier, the individuals that are in our program, we expect them to pay a portion, so that right now we're bringing in approximately $350,000 a year from what I would call the the direct support of individuals for the housing that they're residing in.
Okay.
Now, for the future, you say, what's sustainability? And that is invariably the question we always have. And I would say that REAP over the last 12 years has established the program. We started out with a budget less than $10,000, and we've grown to the point. But we do that because we can show the results. The things that we're doing is working for the individuals. And so we do go, we're constantly requesting funding from other organizations, other community supporters. We normally get about $150,000 a year from charitable contributions. And just like this past weekend, we were the beneficiary of a dinner program sponsored by an organization called Vet CV that is designed. They recognize that a good number of our clients are veterans, and they recognize the good that we're doing. We know that our program works. Obviously, we're specializing. The number of people that are in our programs that have addictive personalities, that's 60% of what we really deal with, and so that's where we work with. But the good news for us is that right now, and these are statistics that are compiled by the Florida Department of Corrections, right now our rate of recidivism is less than 10%. Now, you can figure it different ways, but the way that they do it is if a person is not rearrested or does not pick up an additional charge or violates probation within 2 years after coming to the program, that's a success.
And how many people you see a year?
And at any given time, we have 100, a little bit over 100. It's 103 as of today for the individuals that are in the reentry side, and we have about roughly 75 people that are in the on the homeless side.
And so you need so you're asking for this funding to hire people and actually start to
That
help
really
with the addictive.
focus on the addiction. That's where we are.
Okay, that's enough.
Thank you.
Thank you very much.
All right, and looking at the applications that we have, I know, Matt, you had mentioned about the number of funding. And looking at what applications we received, I feel like the top 5, I think 5 would be where I would recommend that we start with. And I can discuss what 5 that I have for that, or if each of you want to just go down the line, or however we want to do this, but, yeah, or if somebody wants to.
I mean, I can go first.
Okay.
The way I had them ranked, and after listening to it and everything, I mean, pretty much you go off of this survey that we had done, and you've got community health, then you've got Ministry Village at Olive would be number 2, and then Waterfront Mission. They also were right there on the same score with Ministry Village. And then you had, I know Lakeview, the opioid prevention underlying services, they were 3, but the CAT thing is, I think, right now a little better suited for us for the younger generation. And then I really would like to see the lead thing get approved with the school board, and then get funded. I don't know if we should do that now since they're not approved through the school board, but if they could, I think that would be a real great tool for us also. That's kind of where I'm at.
Okay. All right. I'm right along in that vein. So, Madam Chairperson, I actually let me see, 1, 2, 3, 4, 5. Okay, I believe it comes up to 5. Yeah, I just had it written on my sheet different. 1.
Point of clarification, Matt, you're saying community health number 1,
2.
Ministry at Village Olive number 2, Waterfront number 3, and CAT number 4.
Yes, sir.
Okay.
Okay.
And I agree with you on the lead as far as down the road once it is approved for funding or for
Yeah, if she's still here, if you can get approved by the school board and come back and see us, I mean, I have a child in school, so I mean, I want that to happen. So if you can just get that approved through the school board, I think we'll be good to go on that.
Okay. These are my choices, and we're kind of like along the same line, Madam Chairman, with the five. Community health, of course, be the lead because we're already kind of working with them through the core. I see that real time. I actually referred a child to that, someone that had a child with an addiction issue, and when I tell you they were like executed within hours. I called them that day. They were like, where are they at? We can come see them today. And I called the parent. They said, okay, can you just have them to come to tomorrow in the morning? And they were there that day, and they took them through the program. So I've seen that real time. Lakeview Optimist, it wasn't here to kind of break that down, things of that nature. So LEAD, you guys are on the right track. But again, we need some more substance to see some type of results or some type of action that's actually really matching. A couple of private schools in Escambia, don't know how many exactly that would be impacting. So like for you to come back and see us. Ministry Village at Olive, I'm telling you, man, I was like, in the beginning, I was like, man, I don't even know. But after speaking with you and understanding exactly how you operate and exactly what your experience, I would vote for you to do that. But what I would ask you to be is engaged in this process. Anybody that's coming to ask for this substantial amount of funding, we need to kind of see you. We need to know what's going on. We need to know what's happening, because that is a big thing on my psyche, because some of you are like, man, we haven't seen you guys in 2 years. We've been doing this process for 2 years. I'm like, where they've been? So we don't just need people to show up when it's time for funding. We need you to show up to be part of the process, because there were some very important talks of how to get all of you all together on the same page, in the same vein, and to create a vertebrae in our county to be able to deliver these services. And like you said, you were on an island for how long?
2008 is when we started.
You were on an island for 2008. It shouldn't even be like that.
I agree 100%.
It should not be like that. We got a men's center, we got a ladies center, and now we're trying to have Lakeview come in back with the youth from 5 to 18. And so my question is, how do people know all of these services in this city? Where's the one-stop shop they can go to say, I got this, and somebody can distribute them? And that's the problem I have coming into this board. Once we started peeling the situation back, no one's talking to anyone. I know you guys, everybody's talking to Lakeview, because they're like, to go to in some capacity. So I'm glad to see you here. Stay engaged, please.
Can I speak to that just for a second?
Hold on, let me go down. Hold on, we can talk afterwards. Okay. Waterfront Mission, thank you. We know what you do. CAT team, get at it. We're gonna. I want to do this. I'm kind of disappointed you guys did away with the DART. I would like to see that come back in some kind of capacity. Somebody was here a number of meetings ago last year, gave some kind of Jimmy Wig answer of why it went away with that. It was some BS to me. But because we speak to EMS, we speak to the core program, and that demographic of youth is kind of like really, really increasing in the opioid segment so fast. And I know a lot of times we're focused on that 20-something to 40-something, what the statistics say, but if you look at that graph, percentage-wise, on an increased basis, all that them other ages is kind of like stabilized. Okay, we know we're gonna have this many, but that under 18 graph, every time we meet and they give us a graph in here, that graph is steadily moving higher. And I say that graph is moving so fast is that, something needs to be done, and I think we need an intake facility here. So I would, and I know I'm off my tangent, on a tangent, but when we started this board, one of the biggest things that was near and dear to my heart, because of the parents that came by and said their kids died because they didn't have a place to put them because they were under 18. Under 18. So if one of you all that has the capacity to take that mission up, to take that cross up, I'd like to challenge you to do that, because we need an intake facility for under 18. Anyway, I'm back off
Okay.
that.
So back
and
on your
REAP,
5.
I'm sorry, Madam Chair, and REAP, do what you say you're gonna do. Bring some results, because what you're saying is you need funding to get these people in place and to upstart your addiction care. So those are my 5, and all I'm saying is, if you awarded this money by the Board of County Commissioners, do what you say you're gonna do and come back with some results.
Okay. So the recommendations that I have for this would be community health, number 1, Ministry Village, Waterfront Mission. I agree with the CAP program as well as the Lakeview Opioid Prevention Program, because that provides, if you read in there, just some services that are also needed in the community. I would make a recommendation that LEAD apply for funding in June, once they know that they can get the approval by the school board, and that they also have a direct contact connection specifically with the Escambia County Sheriff's Department, Pensacola Police Department. I feel like those are the key things that need to be in place before you request for funding. So those are my recommendations.
Which Lakeview? You got OPU?
I've got both.
Oh, you have both?
Yes.
So you have 6?
I have 5.
Wait a minute.
I didn't have LEAD in mind. I took the top 5.
Hold on. 1. Wait a minute. Hold on. 1, 2, 3, 4. Okay, so not Lakeview CAT, but Lakeview OPUS?
I have both.
You have both. Okay, you just don't have REAP in there.
I don't have REAP. I do not have LEAD. in
Okay,
this.
all right.
Madam
Sounds-
Chair, what does that add up to be? I got
And so
2.2,
go ahead.
2.221219.
That is correct.
Okay.
So that would, yes.
Okay.
So do I have a motion?
A little bit more discussion. So you have OPUS and not, so you have both Lakeviews and not REAP?
Correct.
Okay, so did you have,
I had the same concern.
you had the same, sir? Okay. And Chief Mathis?
I put that in form of a motion for those 5.
You make a
For
motion
position,
for those
yes.
5? Do I have a second?
Second.
All in favor?
Aye.
Aye. Okay. I believe that's all that we have today, or is there any other items that we need to discuss?
Just for LEAD, can you make sure that you get the MOUs with the school board and the sheriff and police department? Okay, thank you.
And REAP, I would encourage you to reapply when the next RFP come out. I think you're on the right track, but however, you're not selected in this round. Thank you.
Ms. Chair, do we need to specify the dollar amounts and those, or are we going to take them as they were submitted? Do we need to do a vote on that, or how does that need to be handled?
Only if you want to change them. If they're as submitted, you're good.
Yeah. Okay. Any other items to be discussed?
Just to give you a quick update, so I'm going to put this on the BCC board meeting that is coming up in December,
Okay.
hoping that we can hit the ground running come January. And then the next notice of funding availability will come out beginning of June. Not sure if you guys want to set your next meeting for January, or how you guys want to do that?
Yes, because this, just to clarify, these are recommendations made to the Board of County Commissioners, and it's up to them to approve this. So I just wanted to make sure everybody understands that. Our scheduling a meeting for January. We've got January the 6th. How does that work?
I'm
Or would
out
you
of the
pre-
office that
Oh,
day.
let's do the 13th. How's the 13th work?
I may or may not be in town then. It's hard to say. It's weather-driven.
Weather-driven. Will you be in town the 20th or?
No.
No, okay,
I could be in town the 6th, and we could still have the meeting without you here,
okay.
but,
Let's-
I can just find somebody to fill in.
Okay. Does 6th work for everybody? Okay, our next board meeting will be on the 6th. And I close the meeting at this time if there are nothing else. Okay? Thank you.